All right, let's move away from talking corruption now, talking healthcare. The global outbreak of monkeypox, which causes smallpox-like skin lesions, but is not usually fatal, surfaced on the 7th of May in the United Kingdom, with numerous suspected and confirmed cases reported around the world.
Monkeypox is endemic in 10 countries in West Africa and Central Africa, with dozens of cases this year in Cameroon, Nigeria, and the Central African Republic. The Democratic Republic of Congo, DRC, has by far the highest burden, with 1,284 cases in 2022 alone. These numbers, of course, are certainly underestimated, with most infections reported in remote rural areas, while in the CAR, armed conflict in several regions has limited surveillance.
Now, alarmed by the outbreak in Nigeria, the Nigeria Center for Information and Technology and Development, CITAD, has called on the federal government to urgently deploy appropriate measures to contain the spread, adding that the experience of COVID-19 is still fresh and should not be forgotten, hence the need for government to treat the monkeypox outbreak with public health urgency. Now, to discuss further on this development and all there is to know about monkeypox, we have Dr. Oladipo Kolawole. He's a virologist and a fellow of the India Council of Medical Research. Thank you for joining us, Dr. Kolawole.
Yeah, thank you for having me on this program this morning.
All right, now, monkeypox may sound like a familiar name to some people here in Africa, but still, let's understand what exactly monkeypox is and how a person can be infected.
Well, monkeypox is not new. From what we have known, it was first isolated in 1958 in monkey, before now being isolated in human in 1970 at the DRC. And since then, we've been seeing cases in Central and Western Africa. Actually, monkeypox is a family member of pox viruses, Puxaviridae, with cowpox and smallpox, so they are in the same family. So that is what I can say categorically on what monkeypox is for now.
Let's talk about the ease of transmission. Now, is it easily transmissible? Is there a possibility of this becoming a full-blown pandemic like COVID-19? Should we be afraid?
I think we should not be afraid because there is one characteristic. That virus is a DNA virus. When we say DNA virus, they don't mutate like the way RNA virus mutates. So their system, their genetic makeup is still very, very intact. But the most important thing is that we need to deceit from animals because like some rats have been implicated as a reservoir for these virus. And we can get the virus, we can contract the virus by getting in close contact with infected live or dead animals at the same time with an infected individual. So, and some people that are even at high risk of contracting the virus are the healthcare workers. So these are the ways in which one can pick up the germ.
Okay, you've mentioned that one of the ways in which we can contract this is by coming in contact with infected live or dead animals. Would you say that proper cooking can kill the virus in meat? We saw recently the federal government, there was an article or a report that the federal government was planning to ban the consumption of bushmeat in order to curtail the spread of monkeypox. So would you say that adequate cooking can kill this virus?
I think I can say that, but still, it's not like that direct cooking when we say animal. Don't forget that these kind of viruses are called zoonotic diseases. Zoonotic diseases are diseases that we get through having contact with animals. When we have hunting and facilities, games, when people go into the bush to have relationship with animals, so that's why we get it. But if you have a normal animals that you want to cook, there is a normal way of cooking because that you can't overcook, but you cook naturally because the nutritionists still have something to say that when you overcook again, there's some part of the nutrient that we will not get. So you cook normally, but the most important thing is desisting away from animals that is likely that have been implicated that you can contract the virus from.
Okay, all right. That question was important to ask, because a lot of people might feel, once it is properly cooked, and put inside stew for amala and ewedu, the monkeypox is dead. Let's talk about the symptoms of monkeypox. Is it deadly enough to cause death?
Yeah, I think it is in two ways. Looking at the report that NCDC put out last week in Guardian and Nation, we'll discover that a single death was recorded. It is unlikely that monkeypox will cause a death, but if the person infected is an immunocompromised individual, maybe the person is an HIV-infected individual or somebody that is using a drug and the drug is affecting the immune system. So if such an individual get the virus, there is likely, if not treated on time, will lead to death. So that is the scenario where death can come in. But without that, if the immune system is strong enough, within some few weeks, they should be able to overcome the virus. And that is also dependent on the strain by which such an individual is infected with. And the symptoms are just common symptoms that you see all around, like fever, headaches, myalgia, means pains of the muscle, and all those kind of things. But the only way that monkeypox can be known is by doing a PCR test. That is the PCR test, the normal one that we use for COVID-19. And one thing that makes us very happy is that COVID-19 has had an impact on our health system. So making that tool at least to be available than what we had before. So it will be easier for us to detect if indeed we're interested in detecting the virus in the community.
All right, this is not the first time we're hearing of monkeypox in Nigeria. Since September 2017 to 30th of April 2022 in Nigeria, there have been a total of 558 suspected cases, and they have been reported from 32 states in the country. This means, of course, it's not new to our healthcare. What have we learned over time that can be useful information for us as a country and as a continent?
Yeah, I think one of the things that we need to do, and the other part of the country need to learn from us, is that we have a good, robust healthcare system. NCDC and Federal Ministry of Health have really trained our healthcare workers in how to handle such cases. So they have a good understanding of it, and they have understanding of contact tracing. So they're able to trace individuals that have gotten had contact with infected individual. This has really helped us a lot to combat the virus in our country. So I think the other rest of the world should try to do that. Then we have effective communication using different methods. And like what we're doing now is part of the community responsibility. And the government has actually been doing that, NCDC has been doing that, passing information across, enlightening the general population about what can cause the disease, what are the ways we can prevent it. So if there are more enlightenment, as we are doing now, it is easier for us to curb the spread of this virus.
Well, does it have the same narrative as COVID-19? Will people need to be isolated when they are found positive of monkeypox? And of course, how can we better protect ourselves? Would we need to start to wear face masks? What exactly should be the process?
Well, I think if such an individual is identified, the best bet is to get the person isolated, because if you look at the skin of such an individual infected, you see that there are some pus that is coming out from it. There's some fluid that is coming out from it. So that is why the virus resides. So anyone that gets in contact with through pus, through any breakings in the skin and gets into it, there is probability that such an individual will be infected. So in that case, such an individual will be isolated from the other general population until the treatment commences. So the next thing we should do is that our proper hygiene, normal hygiene, should be, it's a culture that should be instilled in us. And when we see any symptoms that we are not clear of, the best bet is to go to the nearest health center, nearest health facility, to check out what is actually wrong with us. instead of us sitting at home and believing that we're going to take care of ourselves or going to one patent and medicine seller by the roadside that doesn't have a full understanding of what is actually going on with us.
Thank you very much, Doctor, for joining us. Very quickly, in about 20 seconds, there have been reports that those who have had chickenpox vaccines as children stand a better chance of coming against monkeypox. Are these reports true?
Yeah, it's not about chickenpox again, even more smallpox. Like I said at the earlier stage of this discussion, that they belong to the same family, Poxviridae. So if you have been vaccinated against smallpox and chickenpox, you have like 80 to 85% preventive ability against monkeypox. But that doesn't mean the coming down of the virus will now be dependent on the strain that you have been infected with. And for now, there is no specific vaccine for monkeypox. But like you already said, if you have been vaccinated for smallpox or chickenpox, you have a little bit of protection against monkeypox.
All right. Thank you very much, Dr. Kolawole, for your time this morning. And we, of course, really appreciate the information we've gotten from you. Have a great day ahead.
Thank you for having me on this platform.
All right.